So tonight we want to present to you 5 themes that we will be looking at. The first is promoting the civic education in the nation. We'll have somebody who will do a presentation on that, and we'll have a beautiful song on civic education. Another is the technical, vocational education and training aspect. It is believed that strengthening that aspect will strengthen the middle manpower level in the nation. And so we'll do a song again, and the presentation will be done by the coalition. The third is maternal mortality. My principal is here, Dr. Shepard. She's one of those people who is responsible for training midwives. So in the process of giving birth, there are professionals who will take you through the whole process of giving birth, from prenatal to antenatal to postnatal care. And so we'll do a song on maternal mortality, and there's a beautiful song that we have written about maternal mortality. And we believe as a nation we must be able to gain access to justice. If I have an issue with someone, if I have an issue with whoever, I must be able to gain access to justice. And so the theme, access to justice, has been taken from the Ministry of Justice, and we have already composed a beautiful song on access to justice, and you will definitely listen to a presentation on promoting access to justice. Fifth is campaign against gender-based violence. We all as Sierra Leoneans, we know that this nation is going through a period where women are being marginalized, women are being raped, women are being abused. And we are all aware of the popular demonstration or campaign that we are all harness. It was an unfortunate incident that happened in this country, and we believe as patriotic Sierra Leoneans, we must be involved in the campaign against gender-based violence. And so we have a beautiful song and a presentation that is going to be done on gender-based violence. Ladies and gentlemen, these are the 5 key themes that we will look at for this Sierra Leone Rise Again concert. And I implore you all to join us as we sing these songs. When you are not here as spectators, we want you guys to participate in singing with us and in dancing and in making sure that as we leave this auditorium, we would all be filled with one spirit of propelling this nation from the state where it is to a higher height in the name of Jesus. So thank you all for coming, and have a blessed evening. Thank you very much.
I'd like to invite Dr. Joan Shepard and Samuel again to come on. Give it up for Dr. Joan Shepard. These are the heroes. These are the people that we should be hating in Sierra Leone. They are fighting for our very survival. Thank you so much.
Good evening.
Yes, good evening.
Come on, let's put our hands together for us some more. You know, I've actually heard this name for a very long time, and thank my stars and my God, I've seen it today.
Okay.
Welcome
to
Sierra Leone Rise Again.
Yeah.
What's your take on this concept, Sierra Leone Rise Again?
Actually, I came here this evening to enjoy, relax, and listen to Daniel, but now I find myself right on the stage. So I think Sierra Leoneans, we need to rise again. If you look at the statistics, if you listen to the Human Development Index, Sierra Leone is either at the bottom or second to the last. It is high time we need to get our acts together. We have the talent, we have people who can make it, and we have a Sierra Leoneans who are willing to come back home to join us to move Sierra Leone forward.
Maternal mortality, the word sounds, the 2 words, they sound so big. Can you help us?
Okay, maternal mortality is, women become pregnant. It's those women who become pregnant. Out of the women who become pregnant, those who die out of that number, out of 100,000. So maternal mortality, if you are not pregnant, then you will not die of maternal death.
Okay.
Unless you are pregnant. Somebody who is pregnant, either you are pregnant, you commit abortion, or you go to have your baby and you lose your life. So that is maternal mortality.
How is it affecting Sierra Leone?
It's the statistics are appalling, and the statistics are unacceptable. In 2008, when we listened to the Sierra Leone District Health Survey, it was 857 women out of 100,000 women who go to have their babies that die. But quite recently, in the 2013 District Health Survey, it has risen sharply. 1,360 women are dying. And in fact, for me, these statistics are not real because a lot of women die and they are unaccounted for. On a say na salon, they say na witchcraft and all on our mates, or and so we are not even getting the real figures. These are just ratios, So it's quite sad. And the reason why Sierra Leone is not scoring high when they rate the country, it's because of the reproductive health indicators that we have. And it's
make that clear again, Make that clear again. When they rate the country,
yes,
there are some parameters they look at.
Exactly.
And the reproductive area is one of the parameters.
Yes, exactly. So they look at the number of women who go to have their babies and leave. They look also at the number of young children under fives, that.
So then tell them when you say salon de se controla totola.
Yes, now some of the figures that they will bring we can do. It's a pity, and these are unacceptable. And some of the deaths, unfortunately, they are prevented. These are things that we can prevent. Let us look at why is it that our women are dying. One, if you look at it, you have what they call the 3 delays. But let me start with the causes. You have certain things that kill women. Hemorrhage, the woman will go bleed way born. You have sepsis, a infection. Then eclampsia, once they attack the way give you like feet. And then obstructed labor. And then, of course, unsafe abortion. These are the 5 main causes. But then there are other things that causes women to die also. In the midst of the obstetric causes, you have the 3 delays. In some communities, for make the woman decide, say, if I go where you belly, if I go hospital, now a man get for tell them or model law. So we get tradition in the community. So woman also say when she's pregnant and she has a swollen foot, now one condition we know as preeclampsia. So even in the community, but one two are like, if you remember, we don't start with civil education, we don't start with the textbook and all of that. When women are uneducated, they're not able to make better life choices. When women are uneducated, they go tell us when you foot swell, now boy picking they come on poor girl in Holland better instead they take and say na boy picking. When woman uneducated, they in a community, then mommy, TBA, then they go sit down and belly. When the baby, she's difficulty to deliver the baby, then say na what you get for talk. They go sit down and belly. But if a woman is educated, because we start with the civic, if she's empowered, like Yenny Viv and the other woman, go sit down and was saying granny they all. One lady be the way educated. When the mommy begins to he say no, now take me to hospital. So the delays, ignorance is one, poverty is another one. Some women have no choice but to opt for traditional birth attendants. And the traditional birth attendants, they have limitation. It's not everything they know. When there is obstructed labor, when they put labor for camp, the only thing they go blame at witchcraft or they say the woman get word for talk. And so this woman suffers in silence. Another delay is even the decision now for common community to realize there is a danger, this speaking on the don't find. Even for that woman to access care, the road, transport, the referral system is very poor in Sierra Leone. Although a lot of effort has been made, but quite a lot needs to be done. Some women are remote. There is no way, when you say remote, the woman can be accessed. There is no way. We have to reach those women in the remote. So we need to take the healthcare facilities as close to the women as possible. When the donors, when they come, the areas of emphasis, their own mandates, they will tell you we don't do roads and all. It is soft things that they will fund, So our women. Another delay is actually from the road, the referral system. When the woman then at the hospital, they are also delayed. They say, wait, doctor, maybe they start looking for the doctor. Then they say cesarean section, we have to do way blood. There is no blood. We don't have much blood bank in the country. Sometimes you have to beg people to donate and all of that. So the delays are there. So in the midst of all the obstetric problem, beginning not only don't find the woman is anemic, and then of course now the road to the hospital is a long delay. They get for put her up, she's bleeding, a lot has to be done. I don't think that a woman should die because of giving back. Not that a woman also die because all of us here we were born because of our mother. A woman need not die, A woman need not die. But Sierra Leone should rise again. And some of the things, the traditional practices, harmful traditional practices like early marriage, giving our young girls, this is where religious traditional leaders come in, make picking go school, send the girl picking at school. When a woman is educated, education is key, she's empowered to take certain decisions. If not to education, I don't go see lawyer today. With education, a woman is educated, able for take care of herself, able for eat good food, able for make better life decisions. So I think our women are deprived in the community. We need to engage our women. We need to engage the chief, and on many not a small picking. And our traditional beliefs say we're picking on go society, in Bobby don't rep now for married, and we should stop all those things. Let's educate our girl child to be able. And the boy picking them, they know they suffer, and the girl picking them will become dropout. So maternal mortality, I'm telling you, is a cause for concern. But the good news is that President will not make a public health emergency, and so now it's receiving much attention. A lot has been done, but yet still women also still deliver their babies in community. But then also on us, me and health educator, last Saturday, we graduate midwives at 61. People are also saying that when they go to the hospital, the way the nurse there, they talk to them, and all, happy. So we are also looking at that, the attitude of staff. Women need respectful, caring, quality maternity services. So we need to also talk to the healthcare provider when somebody don't come to hospital for receive and warmly and all of that. So we have a lot ahead, but I believe we should rise again with all the information, with all the concerted effort. And each woman also, as a woman, all women are waiting a man. Let's make it a decision when you want to get picking. Let it be something that's not by chance. You decide I want to born with picking. You decide to make it up. Because who will be going to struggle and sleep, A lot of people again are street where they suffer. Think for itself. Some say, God give me all the egg and go born all the picking. It's not fair to our children. They need to be loved and we need for bringing them come up. A woman needs to, when she's pregnant, it should bring joy. So we should ensure our mothers that safe motherhood is the key. All women feel safe, but you need to go to the hospital, you need to have institutionalized deliveries so that you have your baby. And the hospitals should be equipped. So we rely on the commitment of government, His Excellency, and the partners. Maybe we hospital, there are people that go for the go Ghana for go for breast cancer treatment and all of that. When we get to hospital, we're well equipped. I think UNFP and others and government ministry they work towards that. So our mothers will stop dying. But even the woman, personally, you make a decision to have for born picking and they go hospital. Waiting and tell you for do simple life saving, like for take blood tablets, for each well, each sperma, each well, take good care of yourself when you're pregnant. These are the message we should be preaching.
Well said. I think that's good knowledge. Well said. At some point, I just lock the words to follow. And then you talk. Well said. Well said. Thank you very much. Any last word to especially the women?
My last word is that I think it's so nice for be a woman, but some women know they look at them as a benefit, for say God make me. The chairperson don't talk and say you get no. That Genevieve said be an O, before the woman. So woman they get a key role as a mother, because not only maternity, as a mother also. When you get picky, I don't see a lot of mommy they take care of themselves and they neglect them picking them. We get whether you or your man get problem, let's take care of our kids, bring them come up, spend time, dedicate time, let's invest in our children. We bring them come up, make them go come up fine. As a mother, decide on almost pick you and for born, family planning also that way you use so that you know that picking in our streets. Let's take good care of ourselves, let's be proud of ourselves as women, and let us continue to promote the health and well-being of our children. So that
just an aside. Yes. I noticed that the program is slowly leaning towards women.
Okay.
Are we saying for Sierra Leone to rise again?
No,
we need more women to stand up.
But what we have realized is that the role of men is very important, because even at community level, the traditional, whatever we say in society, the man, even in the Bible, the man they take the lead, it is men. So we need men to come on board. We need men for support the woman and for where they go hospital. You need man for, help the woman make himself become, but we're not going to neglect women then, because we need to take care of you guys. Huh?
Thank you very much. Let's put our hands together for her. Thank you very much. And I'll be back.
Oh wow, they're good. This has been really, really good so far. There's a lot of pressure now on access to justice because the first three have been fantastic. Dr. Joan Shepherd is an amazing woman. We know the problems. We really know the problems. I think sometimes we know the problems. It's about the solution and actually making sure it happens. Thank you so much, Dr. John Shepherd. Please give another round of applause. We're talking about world-renowned experts, world-renowned. We have all the experts in Sierra Leone. We need to use them and make sure that we treat them well and make sure that we recognize their gifts and make sure we acknowledge the good that they're doing in Sierra Leone. Thank you so much. We're going to have a song performance now. Daniel and team. All right, so we have the doctors. We have the nurses. We have everybody. Oh wow. Okay, we have a full medical team here tonight. Where's Dr. Daniel? Dr. Magura. Please welcome Dr. Magura.
Ladies and gentlemen, give it up for the Christian and Scotland. 1, 2. 1, 2.